Primary inherited hypercoagulability is most often caused by mutations in factor V and the prothrombin genes. Factor V mutation is also called the Leiden mutation. Patients with factor V mutation or the Leiden mutation show recurrent DVTs or deep venous thrombosis. But the presentation of the patient and the frequency of the deep venous thrombosis depends on his genetics. So if the patient inherited one defective allele, this is called heterozygote. Heterozygote patients carry a 5-fold increased risk for venous thrombosis if compared with the general population. While if the patient inherited two defective alleles, which we called homozygotes, then they have 50-fold increased risk if compared with the general population. شو معنى هذا الحكي؟ معنى هذا الحكي إذا المريض ورث one allele that is defected, he is called heterozygote, and the risk is only 5 folds. While if he got two defective alleles, إذا two alleles are defective, then the patient is called homozygote, and the risk to develop DVTs and other venous thrombosis goes up to 50 folds if you compare him with the general population. But although the risk of thrombosis is mildly increased in heterozygous carriers, we should focus also on those patients. ليش؟ ليش لازم نهتم بالمرضى الهيتيروزايجوت although they have only 5 folds increased in the risk if compared with the general population? Because they may acquire other risk factors for hypercoagulability, and so the risk won't be only 5 folds in these patients, but it will be added to the acquired risk. ناخد example. فلنفترض إنه عندنا female patient and she has one defective allele of factor V, so she is heterozygote, but also she got pregnant. صارت حامل. Pregnancy is another risk factor for hypercoagulability, but it's an acquired risk factor. هون الريسك لهذه المريضة مش بس 5 folds, it will be more than 5 folds because she has one inherited risk factor and another secondary or acquired risk factor. Another example is كان في عنا patient, male patient عنده one defective allele of factor V Leiden, but on the other hand هذا المريض عمل pelvic surgery and he got bedridden for 2-3 months. Prolonged bed rest is an acquired risk factor for hypercoagulability, so that now the risk is increased for this patient. Another example, patients who have one defective allele and also they go in a lengthy airplane flights, بيسافر مسافات طويلة، رحلة مدتها 20 ساعة أو 18 ساعة. This is an acquired risk factor added to his primary risk factor, so the risk will be increased. Let's now start discussing the secondary or acquired causes of hypercoagulability. The list of secondary or acquired causes of hypercoagulability is long. Here I'm listing the top or the most common causes of acquired hypercoagulability. Oral contraceptive use اللي هي موانع الحمل التي تحتوي على الاستروجين and hyperestrogenic state that is associated with normal pregnancy can predispose to acquired hypercoagulability and so thrombosis. The cause is related to the increased hepatic synthesis of coagulation factors that will result in secondary hypercoagulability and increased thrombosis. That's why sometimes patients who use oral contraceptive pills for a long period of time that contain estrogen, or patients during the pregnancy due to the increased estrogen, may come to the emergency room complaining of sudden pain and swelling in their lower legs, and this is because of the deep venous thrombosis, DVT أو الجلطة في رجلهم due to the hypercoagulability state. Another cause happens in disseminated cancers, which is associated with the release of procoagulant tumor products that predispose to thrombosis, such as mucin that is released from adenocarcinoma. So the release of mucin from adenocarcinoma may help in increasing the chances for this patient to get thrombosis, and this is considered a secondary cause of hypercoagulability. Hypercoagulability is also seen in patients with advancing age يعني عند التقدم في العمر, and this is because they have increased platelets aggregation. That's why we always encourage people from the age of 50 and beyond to start using the aspirin to decrease the chances of the secondary hypercoagulability that is associated with age. Smoking and obesity also promote hypercoagulability, but by unknown mechanisms.